If you are currently dealing with knee problems, what I am about to share with you is genuinely going to help. I am going to walk you through several different techniques you can apply to increase mobility, break down fascia, release scar tissue, and address adhesions within the surrounding tissue. This is critically important because these methods can meaningfully help a wide range of knee conditions without requiring anything invasive. The very first thing we are going to address is the musculature surrounding the knee. This instrument here is a myofascial release tool that I have used extensively throughout my years in practice. Most of you will not have access to this specific tool, but you can find smaller versions that are quite affordable, or you can simply use the edge of a regular fork or spoon from your kitchen. Just make sure the edge is not overly thin, because the thicker the edge, the better it will work for this purpose. Before we begin, we are going to apply an emollient to the skin. This can be a massage oil, almond oil, coconut oil, or whatever you personally prefer. Apply a small amount around the knee area. This will create that smooth gliding motion we need and eliminate any friction or resistance against the skin. Once your oil is applied, take your tool and hold it at a slight angle against the skin, somewhere around 20 to 30 degrees. The exact angle matters less than the pressure you apply, which should be very light and superficial. Do not push down hard. For example, around the top of the knee where the quadricep muscles attach, if you press down lightly, you will often feel a gritty texture beneath the tool. That grittiness indicates the presence of adhesions. Simply stroke the tool lightly and gently over those areas, moving parallel to the direction of the muscle. A very effective additional technique is to also stroke perpendicular to the muscle, crossing directly across it. Perform approximately 10 light strokes over each area. The skin may begin turning slightly red, which is perfectly normal, and actually indicates increased blood supply to the area. Once you have addressed one area, move to surrounding regions and explore different angles wherever you feel that gritty texture. You may find it easier to begin on the lower portion of the knee and gradually work your way upward. Moving parallel, perpendicular, and at various angles across the tissue is all beneficial and effective. Remember that numerous muscles originating from the hip, including the sartorius, the gluteus muscles, and others that cross directly over the knee joint, all contribute significantly to knee pain and dysfunction. These muscles can become excessively contracted or imbalanced due to poor pelvic alignment, altered walking patterns, prolonged sitting, or overuse during athletic activity. Work carefully around all sides of the knee, focusing only on soft tissue areas and never applying the tool directly over bone. On the outer side of the knee, you will find the hamstrings, the abductor muscles, the tensor fasciae latae, and the iliotibial band, all of which attach at or below the knee joint and can significantly influence knee function. Spend approximately 5 minutes searching through different areas and locating spots where that adhesion and grittiness is present. Whether you are using a proper tool, a spoon, or a fork, the technique remains the same. Keep the pressure light and superficial. Alternate between parallel and perpendicular strokes. Use a generous amount of oil for smooth gliding, and watch as the skin takes on that reddish color indicating improved circulation. Once you release those adhesions and the texture beneath the tool begins feeling smooth again, you will know you have accomplished something meaningful because you have restored the normal gliding function within the muscle tissue that adhesions had been disrupting. Now, one of the most critically important and commonly overlooked aspects of knee health is the mobility of the kneecap, also known as the patella. This is a freely movable bone, and its ability to move freely in all directions is absolutely essential for healthy knee function during walking, sitting, and all physical activities. Before checking, make sure your leg is completely relaxed and not contracted. If you tighten your quadricep muscles, you will feel the kneecap lock down, so let everything go completely loose. Your heel should be resting comfortably, and the kneecap should feel loose and freely movable beneath your fingers. Now check the kneecap movement in all directions. It needs to move downward, upward, outward to the side, inward toward the center, and diagonally in all 4 diagonal directions as well. That gives you 8 total directions of movement to check. If it moves freely in all directions, there is not much correction needed. But the reality is that the vast majority of people, I would say approximately 99%, will find at least one direction where movement is restricted or blocked. This occurs because adhesions can develop underneath the kneecap itself, causing it to become stuck and unable to track properly during movement. This matters enormously because your quadricep muscles attach directly to the top of the kneecap. Every time you walk or contract those muscles, if the kneecap is stuck and not tracking freely, you are continuously generating inflammation, creating dysfunction, and potentially initiating a cascade of problems including degenerative joint disease and chronic arthritis. So here is how you correct it. First, identify which direction or directions are restricted. Then take your middle fingers, wrap them around the kneecap on the side opposite to the direction of restriction, and allow your thumbs to rest wherever feels comfortable. Gently take the slack out of the tissue by pulling lightly in the direction of restriction. Once you feel the tension engaging, deliver a small and quick impulse in that direction. You may occasionally hear a small click, which is simply the joint releasing. Perform several of these impulses in a row and then immediately recheck the mobility in that direction. In most cases, you will notice an immediate and dramatic improvement in how freely the kneecap moves. The difference will be remarkable and you will feel it right away. If the kneecap is restricted going downward, place your thumbs above it and impulse downward. If it is restricted going outward, place your fingers on the inner side and impulse outward. If it is restricted going inward, place your fingers on the outer side and impulse inward. Follow the same principle for any diagonal restriction. Release the tension first, then deliver the impulse and always recheck afterward. So to summarize everything clearly, if your knee is actively inflamed and swollen, apply ice to manage that inflammation first. If you find grittiness in the surrounding muscles, perform that light superficial scraping technique using your tool or spoon, always on soft tissue only and never over bone, and never pushing deeply or to the point of pain. Then assess the patella and restore its mobility in any direction that feels restricted using those gentle impulse techniques. You can repeat all of these techniques as frequently as needed. The patella is almost certainly the single most overlooked contributing factor in the majority of knee problems. All of the surrounding muscles attach into and around the kneecap, and any imbalance in those muscles will affect how the kneecap tracks, leading directly to pain, inflammation, and progressive dysfunction. Address it properly, and you will be genuinely amazed at how quickly things improve. Please share this video with your friends and family. Leave your thoughts and experiences in the comments below, and most importantly, go out and make it a truly great day. I am Dr. Alan Mandell. So.